and I would like to thank the previous presenter. It was a beautiful talk, and I have two major lessons about what she said. The first is that political decision about health is a slow process and sometimes contradictory. And it's very difficult for healthcare professionals to understand the tortuous way of thinking. The second lesson is that there is a large place besides media to be very close to healthcare professionals and to provide daily information. And I consider that for years, health authorities has been very silent. They published recommendation. Many healthcare professionals don't know exactly where to find them, or they don't have time to read pages and pages. The public is not really aware where to find information. And finally, there was a void. For a long time, companies were the only one to do promotion of their products for the best, sometimes for the worse. And definitely, I consider that we had a large room to respond to healthcare professionals interested in vaccine. And it's the reason why Infovac was created. I'm, of course, speaking on behalf of our coordinator, and it is Robert Cohen in France, and all my colleagues, because we are extremely close in this domain of Infovac, though coming from different horizons. So in France, it was created in 2003, and we were following exactly the process created by Claire-Anne Sigrist with Infovac Suisse previously. We have some major objectives, and the closest and the most important is to respond to any queries and questions about vaccines and vaccination and policies for healthcare professionals. Initially, you will see that we addressed only pediatricians, then we enlarged to general practitioners, and finally, in the recent years, following the possibilities given by the government, we decided to include pharmacists, nurses, midwives, and you will see that at the moment, we receive a lot of questions about pharmacovigilance centers, though they should have the knowledge, but they ask for some confirmation. And I consider that our main perspective is to answer a specific question, but at the same time, we try in a certain way, the most convenient, to give some general information about vaccines, vaccination, in order to fit. So the main objective is to answer daily to questions and any queries of doctors, healthcare professionals about vaccine and vaccination, simultaneously to educate and inform, and to communicate references and helpful side. So we are not just by ourselves, but we try to extend their knowledge by any sound way. So on this way, we are totally unpolitical. We are, besides administrative recommendation, we know them, we respect them, we follow them as much as possible. But on a case-to-case basis, we give possibilities to utilize some vaccines not yet recommended or no more recommended as rotavirus vaccines, for example, when a question is raised and the doctor has started the vaccine or is raising a point about what could we do, shall I not? And so we give our position per se, but finally it is the doctor who will vaccinate. So we just give advice. We never do recommendation. So as I told you, I can go on. And in fact, Infovac France has three major components. I speak about the internet site, and if you are interested, you can go and see. It's a very interesting, proactive, and I would say daily or weekly renewed with the latest new. So it's another point, and compared to, you have seen the Japan, but it's exactly the same in our country. I consider that due to the situation, actual COVID, the reactivity is quite good, but it was not so good previously. And there was such a delay between the possibility and the decision that doctors were asking what we do. And we are here to say, on a very reactive way, day by day, what we can do or not. So we are giving also the availability of vaccines because we have shortage, and sometimes it's quite difficult. Can we interchange the vaccines? We give basic information on vaccine-preventable disease and the corresponding vaccines, and we have news. So I speak later on about COVID abecedare. The second part, the major part where all the colleagues intervene, is questions and answers. And the third part is at least a month leaflet giving the actuality, giving the newest information, giving some formation education, and also trying to give some case, the most interesting case we had in the month, and giving the answer and why we gave that answer. So it's a really platform of expertise in vaccinology. It is totally independent. Yes, we are funded globally by companies, but doctors pay around 20 euros a year to participate to the system. And it's consulted now by French official agencies. We are totally recognized and appreciate, I consider. Pharmaceutical companies ask us, vaccination centers, especially in the COVID period, and pharmacovigilance centers. So I repeat that we never give recommendation. You know that the principle of subsidiarity in Europe says that only nations, member states, can give recommendation. Even ECDC promotes guidelines, but no recommendation. We are working, I say, in parallel with national sites, and we know them. Santé Publique France has been working quite hard since the mandatory vaccine with vaccinationinfoservice.fr, which is a good site, and we have a look in it, but it's not responding to the practical issues a doctor have about vaccination. And mesvaccins.net is an excellent site also, but they transmit the SPC. And they have a part of information about vaccines, but it's a very good site. And I search a lot of information when I have some answers and I want to check something about the SPC, unless searching on internet full text, they give very important information. So we are not close. We are extremely well identified in our position of responding daily to the questions, but we are not at all excluding the others. And we are reporting official recommendation and the vaccines. So, questions and answers. What are the methods? The people participating, I don't like the term of expert, I tell you. We are a dozen of pediatricians. They are selected for their knowledge in the field, their motivation. We have one coordinator, Robert Cohen, from the early beginning. And I must say that I checked yesterday. We are very stable. We are 10 or 11, and in the 10 or 11, 6 existed and still are from 2003. We need to renew because we are aging, and so we are predicting the future. And we co-opted in the last 3 years 4 people who were interested. We followed the question and answer for several years before accepting. You have to understand that those people are working, all of them, either in private office or at the hospital. And so they are adding that to their burden of work. And I remember when I started, I was the head of a service. I was at the CTV and at the same time at the French Drug Agency with a report on new vaccines, and adding a fourth things was quite heavy, but it was fascinating, interesting, and it was missing in our country. So when it's all the year around, it's 52 weeks. We don't take holidays. It's duties by week or half week. We receive questions between Monday and Friday. And the principle is that the response is given as soon as possible. The best is within the next 24 hours. But we are allowed to give the response up to 48 hours. Because we imagine that if a doctor is raising a point, he wants a very quick response. Health authorities are always respected, and this also is extremely important. And as I said, on a case-by-case basis, Infovac members may support a non-official position. If you go on the site, you will see that we evoke a calendar that is not exactly the schedule official, because we are very prone to the new vaccine not yet recommended. We consider that rotavirus are excellent. We consider that Bexsero is a good vaccine. And, it has been accepted and recommended in the country since July 2021. It will be in the next calendar, most probably. If useful, we send scientific documents and reference site, as I said. But I insist on the fact that each doctor must receive a practical solution for the case. So how do we do that? Questions are centralized by Infovac question. It's delivered by mail to the expert on duty each day from Monday to Friday. And the response is sent to the healthcare professional sending the question, but also to all the members. And I must say that yesterday evening I read the responses, and this morning too. And if you don't follow, you are overwhelmed, because I'll show you how many questions we have. What is extremely important is that reading all the responses, some will increase their knowledge in the field. But we may comment, we may discuss, we may complete, or we may argue. And this is extremely important for the dynamic of the group. We have an annual meeting suspended in 2020, you imagine why. It's during 2 days. We have a feedback on activity, discussion on consensus required about certain aspects, discussion of uncertainties or gray zone, and we know what we don't know, and we try to know even the unknown. We share information. We discuss the novelties in the field, and it's always in a very good and friendly atmosphere. And cohesion of the group, it's very important we meet once a year. So now, from January to November this year, you see the number of questions received every day. And one of our main practical aspect is that doctors say, oh, well, I have a question, but finally I have a second and a third question. And so it's very difficult to follow exactly. So we ask one question per mail, but you see it's not really the case in the questions. So this is from the origin, the number of questions we had and where we started and where we are now. And you may see that it's becoming overwhelming. I consider that I need at least 10 minutes to answer a point, to be sure that I have read the question exactly and find the right answer. But you can imagine that for certain questions, it's much more long. And you can take 30 minutes or you can take 1 hour. It occurs every week because you need new references and you need to check a point and you are searching on internet. So it's both interesting because all the group will benefit from what you have searched for. You yourself, you will improve your knowledge, but at the same time, it's time-consuming. So I must say that one of our major issues now is to know if we can keep a week, all of us, or if it is better to share it, because it's becoming very heavy to have a week. Which type of question? We consider it's rather easy to have individual catch-up. Delayed schedules, missing doses, answers are quick. Migrant schedules and catch-up, we have solved the issue. We have a very good leaflet about rattrapage des vaccinations. And if you see now in our calendar, official, we have also HAS has given a calendar, but we started much earlier. Many questions about travelers and vaccines overseas, underlying disease and vaccination, undesirable events post-vaccination, quite a lot, and some opponents' parents to vaccine. I go back to the fathers, because yesterday evening, in the number of questions, at least 2 fathers refused vaccines. So young people, around 30 or 40 men, are invested in interrogation about vaccines, and I think we have to think ahead of that. And since January 2020, of course, lots of questions about COVID, tests, vaccines, vaccination schedules, what to do, consequences of the vaccine. So this is the front page of Infovac France. I won't detail, you go on the site, you will find it. What are the visits since March 2009 when we started checking? And you see that in 2020, we had a spike due to coronavirus, you can imagine, and it's still ongoing. Number of visits of the site by year, the peak with 2020 and 2021 is going back to the mean, usual. Who is visiting? It's mostly French-speaking. Over 90% of people come from France. It's only French-speaking. And we may regret it, but we can't do more at the moment. Rather young doctors and a majority of male yet. What interested most the visitors? And you see that the first is abécédaire. So I must speak a little about abécédaire. And Robert Cohen just yesterday told me that it was the version 27. So you imagine from the origin of the abécédaire, we follow information, we follow the documents. I must say I've been very proactive in the domain and giving and sharing with colleagues all the documents I had on internet and that appeared to me to be very solid documents about COVID to follow the knowledge of my colleagues, because they have less time than I have. And so you see that this abécédaire, you may find it also, it is renewed. I think it's an excellent formula because it goes from the disease or from immunosuppression or pregnancy or any kind of information about COVID, you will find it here. So it's very interesting. The other major topics on the site are availability of vaccines or shortage. These occur very frequently, and it seems to be uncomfortable for doctors because pharmacies don't have the vaccine. What can I do? And vaccine hesitancy is quite important, but I do insist on the fact that it seems to be very decreasing, and we are following really this aspect. It's very interesting. So about that, I would say that I consider that Infovac is a sort of pulse of the public and the doctors' psyche about vaccines. And this is totally missing in other systems. So it's something I consider as extraordinary because we know exactly where is the public week by week. In conclusion, it is what I call a public pediatrics initiative, nearly 20 years now. We answer practically daily queries and questions. At the same time, we are responding to a strong need to reinforce knowledge and information, and I think this aspect is done with a very diplomatic way. Some people say, well, we are asking a silly question. I always answer, there are no silly questions. It may be a silly response. More and more active site and numerous Q&R, and from time it's training. Experts participate since the early start. There is a need to co-opt French members, and it's Complementary, and in what I say that, Robert argued my term of complementary. I consider that we are doing something not done by others. And so if you have a large view of vaccinology in the country, there is a real need for our system. Thank you.